So I've decided to make these small videos on staging system of various malignancies. I'll be starting with staging of neuroblastoma. Neuroblastoma arises from neural crest cells, and the most common site is adrenal gland. It is also the most common extracranial solid tumor in children. Coming to the staging systems, there are two staging systems. One is pre-op surgical risk assessment. The other one is based on post-operative surgical resection. So the first one is risk group staging system, which is based on clinical features and on imaging findings, that is the ECT and MRI findings. The other one is after surgery, depending on the extent of the resection, we stage this. Coming to the first staging system, international neuroblastoma risk group staging system. Here there are four groups: L1, L2, M, and MS. So coming to L1, the tumor is limited and there is no locoregional spread. In L2, there is locoregional spread to adjacent structures or to the nearby major vessels. In M, which is nothing but metastasis, we find this that is distant metastasis to the adjacent organs, distant lymph nodes, skin, liver, bone, and marrow. And MS is a special category. It is seen if it is present in children under 18 months of age, and there is limited metastasis. The tumor is also limited. There is no locoregional spread, but however, there is limited distant metastasis to 3 organs, that is BLS. Mnemonic is basic life support. B is for bone marrow. L is for liver. S is for skin. Coming to the next important staging system, this was previously called as the Shimada staging system. It is currently called as INSS, so I'll be discussing INSS. So there are 4 stages, just like any other tumor: stage 1, stage 2, stage 3, and stage 4. In stage 1, as I've already told, this is a surgical staging system. In stage 1, there is gross, complete excision of the tumor. So we have went in and we have removed the entire tumor. Grossly, we have removed the entire tumor. However, there could be microscopic disease left over. And there are lymph nodes are not involved. There might be some lymph nodes which we remove along with the tumor. They might come out to be positive, but the adjacent lymph nodes are negative. And in stage 2, there are again two groups, 2A and 2B. In 2A, there is gross, incomplete excision of the tumor. That is, grossly, we were not able to remove the entire tumor. Some tumor was left over. But however, the adjacent lymph nodes were negative. In 2B, there could be gross, complete or incomplete excision, but lymph nodes are positive. Adjacent lymph nodes are involved. In 3, there are 3 scenarios. 3, remember 3 as alphabet C, third alphabet. C used for contralateral spread. So there are 3 scenarios in stage 3. That is, the first one is tumor extending across the midline, or if the tumor is involving lymph nodes on the contralateral side, or if the tumor is in midline extending bilaterally, with bilateral lymph nodes involved. Stage 4 is nothing but distant mets. Involving distant lymph nodes, liver, skin, or bone and bone marrow, or invading into adjacent structures. 4S is again a special category as seen in the previous staging system. This is seen in children with age less than 1 year, and the tumor is limited. There is limited spread of the tumor, that is like in stage 1 and stage 2A, 2B, but however there is limited distant mets. Again, this is also to the same three organs, that is bone marrow, liver, and skin. In bone marrow also there is limited spread and only less than 10% of the nucleated cells are blastomal cells. So that is the staging system of neuroblastoma.